name's Anthony Wilkerson. I'm a student physical therapist at Adventist University of Health Science, and I'm going to be talking to you today about pain assessment with patients.
Pain is sometimes referred to as the fifth vital. Merriam-Webster refers to pain as the physical feeling caused by disease, injury, or something that hurts the body. It is important to remember that pain is a symptom and not a sign. A sign is something that is objective, something that is measurable. Examples of these are heart rate, blood pressure, temperature. Symptoms are something the patient experiences and feels for themselves. These are things that cannot be measured by the healthcare practitioner, but have to be relayed and conveyed by the patient. It is important to be able to assess pain because this gives us a window into the patient's experience. And by gauging the pain of a patient, we can see how they're responding to treatment and have a higher and better outcome for the patient. Another very important aspect to take into consideration when assessing your patient's pain is their cultural and racial background. A study was done comparing Australian women to Chinese women in regards to menstrual pain. In this study, it was shown that Australian women felt 36% more pain than these Chinese women who were in the same study. They also felt that pain for longer periods of time. Minorities in the United States, on average, have a lower pain threshold than non-Hispanic whites. In specific, the study showed that African Americans have lower thresholds than non-Hispanic whites in the following categories of thermal pain, cold compressor pain, ischemic pain, electrical stimulation, and temporal pain. It is important to note these differences when dealing with patients. This helps us to be empathetic with each patient we experience, and it also helps us establish rapport with the patient.
It's important before you start to assess pain with the patient to take into account nonverbal indicators. First, you want to look for any sharp intakes of breath, any facial grimaces, holding the affected body part, or a combination of all three. Sometimes patients may not be forthcoming with their pain, and it's important to look at the different nonverbal indicators in order to gauge stuff that patients won't necessarily tell you.
There are many different methods of assessing patients' pain used by healthcare providers today. The first I'll speak on is the Verbal Pain Intensity Scale. This scale rates a patient's pain from no pain to the worst possible pain. The increments between no pain are mild pain, moderate pain, severe pain, very severe pain, and the worst possible pain. The next scale I'll talk to you about is the Visual Analog Scale. The Visual Analog Scale is very similar to the Verbal Pain Intensity Scale, except it cuts out all the different increments in between no pain and the worst possible pain. You have the patient point to where they are on the spectrum in order to self-identify their pain. Another scale that's very widely used in the healthcare world is the Numeric Pain Intensity Scale. This scale has 11 increments from 0 to 10. 0 concludes that there is no pain felt. 10 concludes that the patient is in the worst possible pain they can imagine. Another very important scale for healthcare practitioners today is the FACES scale. This scale is more appropriate for children who may not understand the other values of pain. Their scale goes from no hurt to hurts a little bit, to hurts a little more, to hurts even more, to hurts a whole lot, to hurts the worst. Studies have shown that this also is very good for patients who have suffered from strokes.
Alright, Mrs. Serrano. So before we get started on your treatment today, I'd like to ask you, are you feeling any pain?
Yes, I'm actually in a lot of pain.
Okay. This is called the Numeric Pain Intensity Scale. And pretty much, if I could just have you on a scale of 0 being no pain and 10 being the worst possible pain, describe how much pain you're in?
It's definitely a 10.
It's definitely a 10? Okay, Mrs. Serrano. Now I want you to understand, a 10 would probably be like if you were working with a wood chipper and you threw a piece of wood in and it caught your hand, that would probably be the worst possible pain ever. So that being said, can you tell me where do you think you fit on the scale?
I guess I'm an 8.
You're an 8?
Yeah.
All right, well, we'll go with it.
I hope today that I've helped you learn more about assessing patients' pain. I hope that I've shown the various aspects of it and shown the importance of it as a healthcare provider. These are my references in which I obtained the information that I presented for you today. With that, I conclude my report.